So we are going to get started this evening. Our session today is how to effectively communicate with your healthcare professional. And this topic will also include some information on the medications as well. So before we get started with our question and answer session, let's take just maybe about 20, 30 seconds. And if each person could go ahead and introduce themselves, and I'm just going to start in the order that I see everybody here on the screen. So Ashley, you want to kick it off?
Thank you so much for having me this evening. My name is Ashley Respress. I'm a registered nurse by training. I've worked in oncology for the majority of my career. I've worked at hospitals such as MD Anderson, US Oncology, and now I work for a company called ACE Cancer. It's a digital health application that helps patients navigate their healthcare journey. And it is an honor to join the ladies tonight. Thank you.
Thank you, Ashley. And Dr. Baylor.
Good evening, everybody. Again, thank you for having me as well. My name is Dr. Shaneka Baylor. I'm a clinical pharmacist by trade. I've been a pharmacist for 15 years now. I've worked at places such as JPS and at Baylor Hospital. Now I am also the owner of Chefs for Seniors, where we actually do in-home meal preparation for seniors. And, I'm looking forward to talking more about how medications and the importance of talking about that with your healthcare providers.
All right. Thank you, Dr. Baylor. And Ms. Deidra Kindred.
Well, good evening, everyone, and thank you for having me. And I am so excited to be on this panel with such amazingly professional and beautiful women. So my name is Deidra Kindred. I am an independent patient advocate, educator, and navigator. I've been a nurse for 25 years. My background is anything ICU for adults. And I'm very happy to be here.
Great. Great. Thank you, Deidra. Okay, well, we will go ahead now and get started. So let's start with Dr. Baylor. From a professional standpoint, what would you as the medical professional like for your patients or your clients when they arrive to their appointments? How would you like for them to be prepared?
So one of the most important things, not only as a clinical pharmacist, but as a healthcare provider, is for my patients to bring in their medications. That's going to be anything prescribed. That's going to be anything you're taking over the counter. That's going to be any supplements that you might take, and bring all of those things in, because that gives us the ability to actually see the medications. Not if you have them in individual bottles, that's preferred. We can look up, pills that are in pill boxes, but it's much harder for us if you don't have them in the individual containers. So that's going to be one thing. Now, I know for some people, if you're seeing your provider quite frequently, you can bring in a list, maybe every 3 months if you're seeing them, but bringing in the bottles at least twice per year. So if you're seen outside, we can go ahead and reconcile or look at those medications and look at your medication chart and make sure that those things match each other.
All right. So Deidra, you want to take that same question?
Yes, so I totally agree with Dr. Baylor as far as bringing all your medications in, especially if it's your first visit to your doctor or doctors, because sometimes you have more than one. And it can be tedious and time consuming, but definitely bringing in those medication bottles to your primary care physician, and then formulating a list of those medications for all your other doctor's visits. And that includes, I go right along with her, over the counter. We don't really think about those as being, medications, and especially supplements.
Yes.
So if you get supplements,
Absolutely.
they have so many interactions that they can interact with other prescribed medications. So everything that you put in your mouth is in the form of a liquid or a pill, let your doctor know about that.
And that's a very, very good point that you just made, because we think of supplements as being natural. So a lot of people are doing the herbs and
Mhm.
They don't think about, even with just foods, certain medications, there's certain foods that you should not be eating with that medication.
Yep.
So that, I think that is a very, very good point that I don't think a lot of people are really familiar with. And, how often do the doctors take enough time to explain it while they're, prescribing the different medications? Okay.
And even when you're picking up, I just want to say picking up medication at the pharmacy, your pharmacist, especially if you're going to several different pharmacies, they're not going to have a comprehensive list either. So they won't be able to say like, hey, this antibiotic might interfere with your Tums that you're taking.
Yeah.
So you're going to need to space this out, 2 hours before or after. So that's why it's important to even with your pharmacy, making sure the list is updated as well.
Wow. Okay. So the little consultation window that you see at the pharmacies is not going to give you everything that you need to know.
No, it's not.
Okay. Okay. So, Ashley, could you tell us who's usually a part of the care team for the patients, or who can they expect to see?
So depending on, where you're going to get treatment. So for example, my background is oncology. So if we can just focus on that possibly. For my oncology patients, your team is a multidisciplinary team. That means that your team is going to be comprised of several different team players. And we always want to honor the patient, because ultimately getting treatment is your decision. So we want to make sure that you have a voice in your treatment and you know exactly who's on your team, who's going to help you get carried to the finish line, right, of your treatment. So when we think about the oncology patient, we think about the oncologist, right? We think about a possible surgeon, a possible radiation oncologist. And then we think about the mid-level providers. And what does that look like? A mid-level provider could be a nurse practitioner, a physician assistant, along with also known as an NP or a PA. And then we also have nurses. So nurses come with nurse navigators. Those nurse navigators are able to help you navigate your treatment journey. Oftentimes, hospitals do have those services. So it's definitely important for patients and or caregivers or someone in your care circle to know exactly who can you go to whenever you may need help. So the nurse navigator is a great resource. I know that they're becoming more broad in larger cancer institutions. And then definitely connect with your pharmacist. Some patients say, I don't know, I've never talked to my pharmacist. I know that they're on my care team, but you can ask detailed questions about medications that you're taking, different side effects or adverse reactions, food that you may have to, go without while taking that particular medication or avoid. Also, dietitians. We do know that patients have a hard time with eating different foods while on treatment. So it's important to make sure that you track your weight, making sure that you don't drop weight excessively. If you notice that you're dropping weight excessively, then maybe it's time for you to get a consult with a dietitian that can help you with figuring out what foods you can eat and possibly gain weight. Do you need some supplements, Also, social workers. Social workers are great resources, have great resources for patients, whether it's financial or transportation. They really can work with you to make sure that you're getting the services maybe that you need. As we know, when we're sick, sometimes we have to get on short-term disability. So that means that your income is reduced. So we know that patients that are normally full-time employees definitely suffer when it comes to having to reduce their pay. So whether it's a hard time to pay your light bill or a hard time to get your medications, you definitely want to know that there are advocates like social workers that are within your hospital setting. There's counselors, therapists, along with psychiatrists. Right now, there's a huge initiative on mental health. And we do know that there's so many different things that come to us on a day-to-day. So we want to make sure that patients have the ability to connect with therapists so that they can talk about their heaviness. And then obviously, Carlene, community health workers, we can't leave them out. They're great resources. They help you navigate your treatment journey. They're also able to help you find resources. And really, friends and family. friends and family that are able to go along with you to your appointments. One thing that I love to educate my patients on, it's always better to have another set of ears because sometimes it's overwhelming. So if you do have a close knit of people in your care circle, I definitely recommend for patients to bring a buddy along with them. And even if you can't bring a buddy with you, definitely consider FaceTime. So yeah, that's what I would recommend.
All right, great. And so I have another question here, kind of ties into what you were just saying there. And I'd like to hear from each one of you on this perspective. So as a community health worker, you know, I'm out there boots on the ground, and we are all the time telling the people in the community that you need to speak up. Don't be afraid to speak up. Gone are the days when, you know, the doctor said it, so it must be okay kind of attitude. So you see a lot of people that are just going along with whatever the doctor's saying, and it appears that their health is getting worse instead of better. And it's probably side effects. It could be a multitude of things. You know, the weight loss that you just mentioned, you never know, but they won't speak up. They won't say anything. So Deidra, you know, especially since you are in the more of like a advocacy, speak up kind of world, you want to take that first? I want to hear from each one of you. Each have unique perspectives.
Absolutely. Yeah, absolutely. I'd be more than happy to. So it's not what you say, it's how you say it. So that is so important. Teaching people how and when is the right time and to whom you need to speak up to. So I'm gonna go back to a point that Ms. Ashley made. She made a point about, you know, basically who's on your healthcare team. I call it building your village. I call it, you know, when you get your care partners. So being able to collaborate with your care partners, saying, are you going to address at the doctor's visit? Don't go in there flying by the seat of your pants and say, oh, yes, and then you're all over the place. You want to have your time valued just as much as their time is valued, right? You are valuable. Your time is valuable. So being able to prep for that doctor's visit and being able to say, okay, these are the questions I really want to ask him. And if you feel like you don't want to ask the doctor that, because certain generations won't speak up no matter what. And certain generations will speak up too much. But if you're prepared when you go in there with your set of questions, so I always tell people, you know, to ask 3 main questions lots of times when you go into the doctor. Why should I do this treatment? What happens if I don't do this treatment? And what happens if I do this treatment? So being able to ask those questions and taking the right type of notes. So I think that is key. Preparing before that visit, kind of having a hone in on what topic you're going to address during that visit, because a cardiologist is not going to give 2 cents about your feet.
That's true.
So being able to have the right information for the right person at the right time in the right place. But that's all about being prepared before you speak up.
All right. So how many people actually think about preparing for a doctor's visit? That was a very, very critical point. Okay, Dr. Baylor. So from your pharmacy / nutrition kind of background, how do you see that that question?
I mean, I agree a lot with what Deidra said. You know, having your questions ready are going to be important, because especially when you're going to a specialist. But from a medication standpoint, you know, coming in and asking us, what is this medication for? You know, because the doctor might say, I'm giving you a medication for your blood pressure and your heart rate, you know, but you miss one, or, you know, you don't understand that you need it for both. And so you're like, oh, my blood pressure is fine, but your heart rate is high. So you don't think you're supposed to take the medicine. So coming in and asking, what should I be taking the medication for, or what am I taking it for? And getting an understanding of that. What are the side effects of this medication? Because, you know, a lot of times we do know medications can cause side effects. Some of them are expected, sometimes they're not expected. We all know when you go to the pharmacy, they give you that pamphlet, that leaflet, and it's got a million things on there, and you don't know if you're, you know, if you're supposed to fear that medication or not. So, you know, getting an understanding of what the side effect is versus how it's treating your ailment. And, you know, what should you do if you can't tolerate the medication? You know, so those are the kind of things that you need to ask, because that way we can come in and we can have that in-depth conversation. So if you have a clinical pharmacist, that's one of the things that they can go over with you, because they have more time than your physician to go through each of those medications with you, which is why, you know, at the beginning we stated about bringing your medications with you to the visit. And then, you know, it goes from there. So those are like the basic questions. What am I taking it for? How often am I supposed to take it? What time, you know, what happens if I miss a dose? And then what are the side effects that I'm going to possibly expect? And when is it important that I notify somebody about the side effects?
Wow. Okay. And yeah, that's very, very good. Because I actually have a client, and unfortunately he's down to like 15% of his eyesight. And the reason for that is that he's diabetic. There was medication that they had given him for his eyes. It was 2 different medications, but the key piece of information that was very crucial is that you had to use both of them. One. And so because he ran out during the pandemic and was only using one of them, now he's in this situation where his eyesight is bad, which they say is not reversible. So that kind of goes back to when you're getting the medications, make sure you're asking, what am I taking it for? How am I supposed to be taking it? And then it's important for the doctors to be very, very clear.
Right.
Yeah.
And that's unfortunate, you know, but that does happen often because it's not clear. And even if you get a new prescription at the pharmacy, you know, when you set that consultation window, people, again, if they don't want to speak up, if they don't want you to know that they might have, you know, some kind of, the understanding, you know, their level of understanding is not what the doctor said, and nobody's going to take the time and say it to them. They don't want to ask because, you know, quote unquote, they don't want you to think they're dumb or, you know, something like that. So it happens, you know, it happens like that all the time, which is why, you know, going ahead and taking that responsibility, but also not just saying, I'm not going to take it, you know, have the conversation with your pharmacist so that you can really understand. And then if we need to say, okay, hey, maybe we should talk to your doctor about trying this instead of this, those recommendations can happen so that we're not missing anything, because that can be a whole other situation.
Right.
Well, I'm going to add to this topic while we're here is that medications, they're the foundation of your healthcare, right? And so sometimes you don't know what to ask because you don't know. You don't know what you don't know. So my advice would be, if you have more than one physician, assign one of the physicians to be that overseer of all your medications. So anytime another physician adds a medication, you must have a reconciliation run.
Absolutely.
Anytime you have more than one physician, they don't have the time to talk to one another. And so it can get discombobulated. Things can get confusing because some medications, they interact with each other and you don't know what you don't know. So if you don't have a primary care physician, for me, there's like a hierarchy, and Dr. Baylor and Miss Ashley can, you know, I think that if you have a kidney doctor on board, that's the one you want to go over your medications. If you have a liver specialist on board, that's the one you want to go over your medications. Cardiology, and then primary care, unfortunately, but that's just the nature of the game, because anytime someone adds something else to the pot of soup, it's going to change the mixture,
Yes.
right? So
Absolutely.
you want to know, it could be something minute as Lasix, a diuretic, taking that with a sleeping pill.
Yeah.
You don't want, you know, so you really need to be an advocate for yourself, knowing what's going in your body and the why and the when and the what. And that's getting a buddy system, like Miss Ashley was talking about earlier, you know, having if you're a solo senior or a solo person, have a friend. You go to the doctor with me and I go to the doctor with you, and you take notes, and then we talk about it after that. And then we find someone who's going to run a medication reconciliation for us. Maybe that's your pharmacist.
Yeah.
Maybe that's your primary care, but whoever it is, anytime something is added, you need to have a medication reconciliation run.
Oh, okay. I like that. You know, I like putting a hierarchy on the doctor, because, bottom line, when you think about it, all these medications, what are the two most crucial organs in keep everything filtered? You've got your kidney and you've got your liver.
Yep.
And so if you do something to mess your kidney up, you're pretty much kind of done.
Yeah.
Ashley, so what's your take on that?
I think that there's some amazing talking points that both ladies came up with, and I just would pretty much just piggyback on and kind of echo what each of you said. Is just the main thing for me is just to be prepared as you possibly can be. And I do know that as you're going through treatment, it's sometimes hard because you're tired or you're not feeling well. But the main thing is overall, you have to advocate for yourself. You have to advocate for yourself. And I love to see when I have patients come in and they're ready to advocate for themselves. And so they have their questions, whether that's through an app or through on a notebook, a sheet of paper, or through their phone. And they're asking those pertinent questions that they really want to know. And I honestly think that the ability to ask open-ended questions are important when you talk to your providers. Open-ended questions are questions that you don't receive a yes or no answer to. This is the ability that this gives the clinical team the ability to explain to you, and hopefully that will open up more dialect so that you can talk about like other things, while you are in the appointment. And so that would just be really my talking point, is to be prepared as you can possibly be. And we do know that doctor's appointments are fast, sometimes 15 minutes. So what can you really do with 15 minutes? Not much. So you really want to utilize that time to the best of your ability, so that it's worth your while, especially since you're paying a copay for it, right? You want to get what you can get, right?
Your money's worth.
It's a service. And so definitely think about that. So again, talk to your care team about any hesitations that you may have. And it's just really important from my perspective as someone that advocates for patients, is just to have honest conversation. Those questions that Deidra had communicated, definitely ask those types of questions. How is this gonna affect me? How is this gonna affect my day-to-day life? What are the adverse reactions that I might have, or side effects that I might have? How can we mitigate if I do have these side effects? Because again, we don't want patients to suffer in silence.
Right.
And that's a very good point, Ms. Ashley, about suffering in silence, because documentation is key. Not only for our healthcare providers, but for you as a patient. So, because I guarantee you, if you go to the doctor and you say, well, hey, I stopped taking my XYZ, and they're going to look at you like, well, why? Well, it made me feel sick. But what did it do? So they want to know. So I teach my clients how to document that appropriately. All my clients, they know all their medications. They know the reason why they're getting those medications. They know who prescribed those medications, because sometimes there's duplications between two doctors. That's an issue too.
Absolutely.
Yes.
And
yes.
I was gonna piggyback on that, because what I was going to say is that when you're talking about the duplication of the medication, so two examples, like you, Miss Deidra, if you have a patient that goes into the hospital and then gets discharged, a lot of times, you know, that med rec that happens on the discharge from the hospital, the patient might end up taking two medicines that do the same thing, but they're in two different classes and they don't know the difference. So that's why it's always going to be important, you know, to have your navigator or your buddy who can follow up with you, you know, to make sure that you're talking to whoever that physician is going to be, so that you can get it, you know, handled and they know the difference. And then also, like what Miss Ashley was saying earlier as well, even when you're talking about a cancer patient, a lot of times when they get discharged from the hospital, they have inpatient pharmacists that come and sit with you and will go over, you know, all of their medications, all of your medications on discharge, what started, what changed, what you need to continue, and what you need to stop. So take up all of that pharmacist's time, you know, so that you can get an understanding. That's what they're there for, you know, especially, and even in hospitals now, they have what they care, you know, transitional pharmacists or med management pharmacists that should be going over your medications when you first got in and when you first come out, so that you can get an understanding, and then even follow up with your pharmacist at when you're discharged at wherever you pick up your medications. So get an understanding, because a lot of times when you're discharged, that's where the confusion lies as well.
Yeah.
Wow. And I think that's where the eye opener is, right? What you just said was, you know, that was kind of concerning and, you know, could be kind of scary, that you're taking two medications that are for the same issue. And so, you know, if you're doubling up basically, which is what you're doing, now you're over medicating yourself. And if you're not keeping track of your medications and all of your doctors don't know that this doctor's already given you something, they're not, you know, they don't know the different medications that you're on because you don't have a list and you don't take a list, you know, that's further detriment to your health. So, I mean, wow, this is great. And there's a lot of different nuggets in here. So how about you guys just kind of, and whoever wants to go first is fine, but what are some of the questions that you get from your patients? What are you hearing most out there?
Why do my doctors ask me the same questions every visit?
So is that because they're trying to see if you actually know, or why is that?
I think the doctors are so overwhelmed these days. I had a conversation with one of my clients. She was like, I told him that the last visit. And unfortunately, yeah, I'm going to say it because, yeah, insurance runs medicine. So they make these doctors see X amount of astronomical, where you cannot have the time as a human being to really understand what's going on with that client. And sometimes they're just skimming over real quick and then they go into the room. And then that's why it's so important for you to build your team. Because when you have your patient advocate or your care partner or your buddy there, you can kind of help the doctor get redirected. I feel like sometimes I'm going to get passionate. I feel like sometimes we put too much expectations on a doctor who's a human being.
Absolutely.
And we have to take responsibility as far as our healthcare journey. So taking somebody with you that has a different set of eyes and ears, just like Miss Ashley said. I say it all the time. It's like going to shopping for a car. And you're like, oh, yeah. And then your buddy can say, well, wait a minute, the gas mileage is not that good. Yada, yada, yada. You need that at your doctor's visit.
You do.
You need somebody else with you so that you can help remind the doctor, okay, we discussed this last time. Last visit, we talked about your hemoglobin A1C. It was 10.8. This visit is 7.4. Well, how did that happen? So being able to collaborate with the doctor, and that's what being your own advocate is all about. It's about being able to help the doctor help you, like
Yeah.
Jerry Maguire, help me, help you.
Yeah.
Exactly. So Dr. Baylor, what do you?
So one of the questions I get a lot, one thing would be, do I have to take it? Or do I have to take it as prescribed? And then another one is going to be, well, isn't there a supplement or, something natural for that? So, as far as the taking it as prescribed, I like to educate people that yes, you need to take it as prescribed. And it goes back to a couple of things, because number one, it could be cost. And which is a reason they don't, they're trying to make the pill last until they get their money for the next month. Or if you have Medicare, you're trying to get out of the donut hole, so if they're having those issues, then we can have those conversations about, okay, let's see what your insurance will cover if you have insurance. If you don't have insurance, if you pay cash, let's see what's within a more affordable range of medications for you. Let's see if there's a patient assistance program that you qualify for, so that some of these medications can be covered by the company free of charge. So, those are going to be, once they ask, do I have to take it like that? Those are the questions that I start thinking about is, why do you not want to take it like that? Or, oh, I always forget to take my evening med if it's twice a day. What do we need to do? Do we need a pill box? Do we need an app with a pill reminder? Do we need to talk to the doctor to see if there's an extended release version so you can only take one a day? But that's how those conversations with us help, so that we can make sure you're doing what you need to do to take care of yourself. Now, as far as, is there a natural thing, I tell people the most natural thing you can do is eat the best you can. For some medications you're not going to be able to eat the way you want to. We'll say, like, if you're taking the blood thinner warfarin, let's say you do like leafy greens, well, then you need to work with your provider to see about eating your greens consistently and monitoring until you get to that point, so your numbers and the vegetables that you want to eat line up. Do you want stuff for other things? Well, yes, your diabetes. Well, how many carbs are you eating? What are you doing with this and that? We may be able to get you off of insulin, but you still might have to take a pill. But the only way we're going to know that, like, you're going to have to work with your team, as Ashley talked about earlier, your dietitian, your nurse navigator, your pharmacist, getting those numbers assessed and seeing what we can do. Yes, the difference between a medication and a supplement is that the medications have gone through clinical trials. They've been regulated by the FDA. There's a rigorous standard and system. A lot of times with supplements, we don't always know what's in them. If you think about it, every day, something is getting called back because something has been added, or they figure out that they found lead, or just something else within that, if there's not a third party system checking those things. So a supplement is not always going to work. And just because the supplement on the bottle says it helps that condition, you don't know for you if it's really going to help or hurt that condition. So, those are the kind of conversations and the questions, I get. They're not going to want to ask their doctor, well, do I have to really take this? And then, on the reverse of that, I'm going to ask them, well, how are you taking it? Because if they ask me, do I have to take it like this? I'm going to say, how are you taking it? Because then when you go back to see your doctor, or you have Miss Deidra going with you, and they think your blood pressure is not going down because you're taking the medication as prescribed and you're not, that's another conversation to have with your doctor, because then they'll start adding another medicine and the cycle continues.
Right.
Yep.
Wow.
Exactly.
So another one of what I just gathered, my summation of what you just said. So natural, unless it's, if it's really natural, that means it came out of the ground and you're eating it, not just because you went to the health food store and something that said that it was natural and organic.
Absolutely. Because, again, if it's in a pill, it's been processed some kind of way as well. So how natural is it?
Mhm.
Right. It can't be. And so I have one question to throw in here, and then we'll keep moving. I've had people that say, well, if I'm getting a generic, I'm not getting, the real, like, are they giving me a sugar pill? Or
Yeah.
what's the difference between generic
Yes.
and, the name brand?
Okay, so with the name brand, when a medication is first created, there's a manufacturer that makes it and brands it. So, it's just like if you go to the grocery store, you got you got your Target brand, and then you have whatever the brand name is. So you have Target ibuprofen, and then you have, your Advil. So the only thing is that Advil created it first. But after a period of time, all of the active ingredients in that medication can be used by another company, and they can create that same medication, which is why you'll always see, it'll say same active ingredient as Advil, same active. So that's the exact same thing. It might have a different filler, which is only going to be the thing that holds the pill together. But the active ingredient, the amount of the active ingredient that's in there, they have to be the same, or it cannot be approved by the FDA. So your generics get approved by the FDA as well.
Okay. So basically, once they've made as much money off of it as they can.
And it only lasts for, just like if you were to create something, a patent is only going to last for so many years. So it's the same with medications. Sometimes it's 7 years, sometimes it's 10 years, depending on if it's something that's needed, like right away, it might last longer. But, at some point that patent expires, and anybody else can also create the medication for a more inexpensive price.
Got you. Okay, so now I guess we can start wrapping up, but is there anything else that we missed that you ladies think would be, some crucial nuggets to give to our audience today?
I actually have one, and I think that this could possibly be a good closing point. But as a nurse, I've seen where providers have had poor bedside manner. And as a nurse, it's very hard for me to watch. And so what do patients do when you're experiencing poor bedside manner, meaning the doctor may be not listening or disrespectful or kind of talking over you or talking at you, right? Or just make you feel small. I think that one of the things for me that I'm very passionate about is when you do feel smaller than what you are, right? Is definitely to speak up because, you're already going through something, and that is not what they signed up for. So when it comes to second opinions, I'm a huge advocate for patients to seek second opinions. If you feel like doctors, you're not receiving the care that you deserve, or if you have something within your gut that's telling you something is off, definitely don't just settle for who you've connected with. Do your research. And if you can't do research because maybe you don't have a computer or maybe you don't know who to turn with, again, you have a care team that should not hold anything against you. So definitely verbalize when you don't feel at your best when communicating to your care team. If you feel that you're overlooked, definitely make sure that you're communicating that, because overall their hospitals are rated, doctors are rated. And so one of the things for me is just making sure that, again, patients have a voice and have the ability to receive the care that they deserve and that they need. And so ultimately, like Deidra said and Dr. Baylor said, there's only one you, and then there's a care team. And really, it's a service that we all provide. This is something that we all went to school for. So being treated poorly as a patient is completely unacceptable. And when you're faced with that, I'm sorry, but you definitely need to seek another option for care. And one of the things that I wanted to say is I do know we are on a panel with majority, obviously, African-American women. I'm very passionate about looking at health disparities within the community. And when I mean health disparities, it's not just within the African American community, but with minorities, where there's barriers to care based on your ethnicity. And I really want patients to feel empowered when they go to the doctor, that they know that, they can get the help that they need. And so that's really something that I think all patients should understand, is that you don't have to just settle for the one particular provider that you were maybe referred to or paired with. If you're not receiving the care that you think you need, then definitely communicate that you may need a second opinion.
I am so glad that you brought that up, because that is absolutely critical. You don't know how many times I have heard people complain about their doctors. He doesn't listen to me, or, he just completely disregarded what I said.
Mm-hmm.
And even asking permission to get a second
opinion.
You don't have to ask permission.
Yeah.
A second opinion, and definitely don't be afraid to walk away from that doctor. And I don't know if, somebody can suggest this to the medical schools around the world or whatever, but I think that there needs to be a bedside manners class.
Yeah.
All physicians, when they come out, because it's kind of like they have this arrogance that, I went to school for however many years, so what I say goes. And they, some of them have, dismissed the patient. So that was absolutely a great comment. I'm glad you brought that up.
Yeah.
So Dr. Baylor, do you have any closing remarks?
No, I don't know how to follow that, but no, I mean, I absolutely agree. We are here to serve you as healthcare practitioners, healthcare professionals. It is our job to serve you. So, the thing is, take everything that we have mentioned tonight, definitely having a buddy, having somebody who can follow up with you and talk to you about your medications, making sure your pharmacist at your pharmacy is part of your healthcare team, so that they know the differences of what's, can talk to you and you can build that relationship. It's all about relationship. And, like Ashley said, if you're not comfortable with that physician, find another one. If you have to go to 5 of them till you find somebody that you feel comfortable with, do that. And if you can find a place that has, all of your team embedded, that's even better. So that you have your doctor, you have your social worker, you have your pharmacist, you have your nurse navigator, you have everything that you need, and they connect and they talk with each other.
That's great. And one other thing that I thought about along the lines of the pharmacy is pick one pharmacy, use that pharmacy.
Please.
Popping all over town, because now your records are everywhere, and
and that's how accidents happen,
exactly.
And things like that. And I do understand emergencies and things like that do happen, but for your everyday, all the time medications, try to stick with one pharmacy. And you don't have to go to a big chain. There are still plenty of mom and pop pharmacies that can offer you personal guidance. They can even, deliver your medications to you, all the things that you need. So yes, absolutely. Pick one pharmacy.
Okay, great. Okay, Deidra, what closing remarks do you have for us here?
Well, goodness. I'm going to go with, it starts with you. It starts with you deciding to be the driver in your healthcare journey. There's only one you only have one body. And building that team of your healthcare village. They always say it takes a village to raise a child. It also takes a village for you to navigate your healthcare. And take the feelings out of it, because there's been we can go on and on all night about doctors and some nurse practitioners who have attitude, but don't go there with them. Being in charge of your medical care starts with you, and that means that you have to learn to speak up for yourself.
Yes.
You have to learn to go ahead and talk about those things that we don't want to talk about, like designating a medical power of attorney if you can't speak for yourself. Being able to know how to pick that medical power of attorney, because a title doesn't mean that they qualify for a medical power of attorney. Documentation is key. Build your medical binder. I can't harp on that enough, because I guarantee you, when you go to your healthcare professional and they see you're documenting and you are making changes, you are making changes, and you're documenting those, they get impressed by that. And then sometimes the attitude may go away.
Mhm.
So it starts with you being in charge of your medical journey, collaborating, getting that team together, and being in the driver's seat.
Okay, so that was such a great conversation that we've had this evening. And I want to thank you, ladies, on behalf of Cancer Care Services for joining us this evening and for sharing that information with us, sharing your expertise. And everyone, Cancer Care Services, as you know, we're here in Tarrant County, and we believe that no one should cope with the effects of cancer alone. And here at Cancer Care Services, we provide free cancer support services to everyone in Tarrant County. And we are the ones that'll walk with you through your cancer journey, and we'll help to limit the impact of cancer on your financial, emotional, and your day-to-day well-being. So again, ladies, I want to thank you for joining us here for this August session of Wellness Wisdom. And we hope that everyone has learned a little bit more to help you to advocate for yourself and take responsibility for your cancer. Thank you so much. Everyone have a great evening.